Hello, my name is Mario Castro, and we will be talking about hyperthyroidism today. So, main question here is what is it? What's hyperthyroidism? And it is a condition in which the thyroid creates and releases hormones that your body needs. It's also called overactive thyroid. The main hormones that your thyroid makes include what they call T3 and T4, which these are a little bit tough to pronounce, but try idothyronine, and which is T3 and T4 is thyroxine. So it affects your whole body, um, and it is a condition that needs to be treated by some type of healthcare provider. So what does your thyroid do? It's located, first of all, the front of your neck, and it is shaped it is in the shape of a butterfly. It is also a gland, and these glands are found all over your body. Um, and then in this case, this gland create and release hormones. They help your body function and grow. The reason this thyroid gland uh, is very important because it helps with one of the main functions of your body, including regulating your temperature, controlling your heart rate, and controlling your metabolism. Everything is working and everything's in balance, um, people don't really notice that it's there, that it's working, but it's until it stops working, wherein either it creates too much or not enough hormones, that your body starts feeling this. So a quick little definition: hyperthyroidism is when your thyroid's a little bit too active, and so it releases extra um, hormones versus which hypothyroidism, which doesn't release enough. All right. For our next slide, the etiology of what causes hyperthyroidism. It has several causes. One of them includes Graves' disease, which is an overactive thyroid nodule, uh, inflammation of the thyroid gland, um, which is called thyroiditis, um, too much iodine, too much thyroid hormone medicine, and a non-cancerous tumor in the pituitary gland are all causes. Um, or what can cause Graves' disease? Graves' disease is the most common cause of hyperthyroidism, and it is an autoimmune disorder. Um, so, in active thyroid nodules, they are essentially lumps in your thyroid, and excuse me, they can be common but not usually cancerous. However, when there are multiple of them, and they become overactive, they produce too much thyroid hormone, and it's often found in older adults. Thyroiditis, excuse the pronunciation. It's the inflammation of the thyroid gland. Um, so some of these, uh, what ends up happening is the thyroid hormone leaks out of the thyroid gland, and it leaks into the bloodstream. What happens is you develop symptoms of hyperthyroidism. And the types of thyroiditis that can cause hyperthyroidism uh, is subacute thyroiditis, which is an inflamed and enlarged thyroid; postpartum thyroiditis, which can develop after a woman gives birth; painless thyroiditis, and it's similar to the postpartum one, but it's when people don't go through pregnancy first. Um, in some cases, the thyroid is overactive over a period of time and then can suddenly become underactive. Too much iodine. So the thyroid creates iodine to make the thyroid hormone, but too much of it affects how the hormone, how much of it is created. So in some cases, large amounts of iodine can cause the thyroid to make too much of this thyroid hormone. And some example of taking too much of it um, comes in for people that take cough drops, medicine, and some heart medicine. They contain a lot of iodine. The thyroid hormone medicine um, can also lead to hyperthyroidism. If you take, you have to see your doctor at least once a year to make sure that the amount that you're taking is not excessive, because that can also be a cause of it. And lastly, if there's some people that develop these non-cancerous tumors in the pituitary gland, which is located at the base of the brain, and that can cause um, the hyperthyroidism. Uh, for the pathophysiology, it really depends on the variant of this hyperthyroidism. So, to give a little recap here, so in the case of Graves' disease, since we know it's an autoimmune, the production of the thyroid stimulating immunoglobulins that bind the TSH receptors and mimic the effects of THS. Graves' disease presents with two extra thyroidal signs that are not typically seen in other forms of hyperthyroidism. In iodine induced hyperthyroidism, it is typically iatrogenic, which results from the administration of iodine containing medications such as contrast media or amiodarone. The organification of iodine residues into precursor thyroid hormone molecules is relatively self-regulating. Looking at signs and symptoms. So one may ask, how do I determine this? How can I determine that I have it? Some symptoms of hyperthyroidism include a rapid heartbeat, also called palpitations. If people are feeling shaky, nervous, some weight loss can be observed. If you have an increased appetite as well, diarrhea or frequent bowel movements, vision changes, thin, warm, and moist skin. For women, if they start noticing there's menstrual changes, some people develop intolerance to heat and start to excessively sweat. Um, at some instances, people are not able to sleep. They have sleep issues. Um, they have swelling and enlargement of the neck from the enlarged thyroid gland, hair loss, and change in hair texture. So for some people, their hair might become very brittle. And in cases with people with Graves' disease, the bulging of the eyes or muscle weakness. What are the treatments? Here we have four of them. The first one being radioactive iodine. It's taken by mouth. Um, the iodine is absorbed by the thyroid gland, where the result of that is that the gland ends up shrinking. The symptoms usually go down within several months, and the excessive radioactive iodine disappears from the body anywhere between weeks to months. This type of treatment causes the thyroid activity to slow enough to be considered underactive, also called hypothyroidism, and may eventually need to take medication every day to replace thyroxine. The next treatment is anti-thyroid medications, in which these medications slowly reduce the symptoms of hyperthyroidism by preventing the thyroid gland from producing excess amounts of hormones. Um, these symptoms usually begin to improve within several weeks to months, but the treatment with anti-thyroid medications typically continues for at least a year and often longer. Um, it depends. It depends person to person, but this may clear up the problem permanently. But other people have experienced a relapse. Um, the drugs that are given may cause liver damage and sometimes even death. Um, so it's usually given in only certain cases. Um, there's also people that may be allergic to the medication by developing rashes, hives, fever, and they because of that you may be susceptible to infection. The third one is beta blockers. Uh, that although drugs are usually used to treat high blood pressure, um, these can ease symptoms of hyperthyroidism, um, such as helping with the rapid heart rate and palpitations. The doctors usually prescribe these until to help the individual feel better until the levels of the thyroid are a little bit closer to what they should be. These are not given to people who have asthma. And lastly, surgery, what is also called thyroidectomy. Um, it's given to people who are pregnant, for people who can't tolerate the anti-thyroid drugs, and or also people who don't want the iodine therapy. This is an alternate option to have the thyroid removed. Uh, for screening, one of the things that can be done is getting a physical exam. Um, the doctor might be able to detect whether the excuse me, the exam that the doctor gives may try to detect the tremor in your fingers when they're extended, overactive reflexes, eye changes, and warm and moist skin. The doctor might also try to examine the thyroid glands as the individual swallows to see if it's enlarged, bumpy, tender, and they'll check your pulse as well if it's very fast and irregular. The other mode of screening is blood tests, which when they take these blood tests, they're measuring for the thyroxine and thyroid stimulating hormone with the TSH in order to diagnose uh, such such illness. When the levels of thyroxine and a low or non-existent amount of THS um, are when they get those results, um, they can that indicates an overactive thyroid. The amount of THS is important because it's the hormone that signals the thyroid gland to produce more thyroxine. So, and then these are my references here. Hopefully, we all get a chance to learn a little bit about what hyperthyroid is. hyperthyroidism is. I definitely learned a lot. Thank you for listening, watching.